Growing up, my mom was a secretary at the local hospital, and I would visit her after school. And I met some of the physicians there, and there was some interest at that point, but I had some family that became ill, and I got to work closely with the nursing staff that took care of them, and at that point I actually switched my majors into nursing. While working in the hospital, I got to work with the residents and fellows and the physicians, and I realized pretty quick that I wanted to go further. So within 2 years of graduating from nursing school, I was right back into medical school.
Neurosurgery is something that gives me the ability to be on the cutting edge of medicine and to really see a difference in my patients, and whether it's a brain or a spine surgery. I know that I can alter things, alter the course of disease so that they improve neurologically.
I've always found that the brain is the essence of who we are. All our memories, all our thoughts, all our actions, all our loves and fears all stem from our brains. So I wanted to be a part of helping people who had brain injuries or issues within the nervous system, and that's how I ended up going over to neurosurgery.
I feel that most people don't need surgery. I know the surgery is part of my specialty, but it's also conservative care. I try to treat all these patients as if they were myself or my family, and I think it's important because if we can work together, we can usually formulate a solution and get to some type of relief of their pain or suffering or debilitation without even going to surgery. But if we ever do embark on surgery, it's going to be something I can do as minimally invasive or as minimal as I can, period, to get them to where they need to be.
I am very conservative when it comes to recommending surgery. I want to do surgeries that are going to make people better, that they're going to have good outcomes for. I'm going to be giving them the best care that I am capable of giving them.
If a patient needs to be seen, we will take care of all that, whether they need imaging, whether they need physical therapy, whether they need an authorization. We really want to keep the door wide open. We don't want to have any obstacles that have people accessing us because we really want to be there for them.
I think that the nurses at CHRISTUS and basically everyone that works within CHRISTUS has a common goal to do what's best for the patient. And that's one of the reasons I, as a neurosurgeon, choose to take most of my patients to CHRISTUS, is because of that community and that mentality of patient first and paying special attention to the patient's needs.
We are doing our best to stay at the forefront of neurosurgical procedures, and that we're going to do the best for their patients.
All three of us, we all have this passion but also experience. We basically perfected the most recent and most innovative technology to treat our patients, and all three of us, we work together as a team. So we strive really hard working together to give each patient the best outcomes. We're really up to date on all the newest techniques, and we really want to share those with the community.